find new ways and new techniques of doing this. So where do we go from now? From our standpoint in public health, it is how do we better document the impact of conflict on a population? Not just because it's a curiosity and we want to have those confidence intervals narrower and so forth, but how do we use these data to protect people wrapped up in conflict? And this, of course, is not the only conflict in the 21st century. There's going to be more. How do we collect the data and we can use this in some way to protect populations involved and do this in a systematic way that people can agree on and that we can use this for comparison. So that's my presentation about Iraq.
Thank you very much. Great. So we can open up for good. Here's someone volunteering.
All of the projection from the cluster to the total population depends on having an adequate census.
Yes.
And that seems to me that the census is accurate and complete, and we know that people are fleeing the country, and there are a million people in Jordan, etc. I think it's a wonderful study, and I've been defending it a lot. But I you know, obviously I wasn't going to go around and say what I thought might have been some problems. But you talk about it.
Oh, that's a huge issue. The census data, and the census we ended up using were the 2004 UNDP estimates, and those came in actually a little bit after we started the sampling. So in the end, in the statistical analysis, we trimmed a bit on our samples to try to match more closely the 2004 data. Now, when we were doing the survey in the middle of 2006, the large-scale migration out of the country was just starting up. And we were starting to see some of the ethnic cleansing, if you want to call that, or at least the sectarian cleansing going on, but it hadn't really gotten established. So I think we got in there just before the major distortions of this would have occurred. Right now, we're just starting a study of health workers in Jordan, trying to look at where they came from, what they're doing, what their anticipated activities will be for the future. And one of the things we want to look at is where they come from in the country, so we can get an idea at least about some internal activities. Now, one of the issues about looking at what are known as refugees, and of course, a lot of the displaced in Iraq are really not refugees, they're internally displaced persons, although the UNHCR has taken a lot of the responsibility for this. And we still have a lot of what they would call old caseloads from the Kurdish migrations and the first Gulf War. So some of those old numbers are mixed in with the new numbers, so it's sometimes hard to sort out. But there's no doubt there is a lot of what the demographers would call demographic churning going on in the country right now. And so that is a real risk in this. It's certainly true.
Great. Janet, please.
Gil, just a really impressive study.
You'll have to speak up, I think.
An impressive study, and I think we're in your debt. I have a three-part question.
I always like
one
these
is
three-part ones. I always forget the second two.
Yeah, well, two are related, so it's
Okay.
almost two and a half. So for the, when you get information about the deaths, and you said most of them don't occur at home, do you have any sense about whether or not they got some medical attention or not? And related to that is, did you get a sense about injuries that were not fatal? And so those are the related ones. And the third one is a much more general one. With all your experience all over the world, do you have any example where country X cares about the deaths of country Y?
That's a very good question. I think about I'll go back to the injury ones, because John and I had a lot of discussion about that, and we wanted to collect data on hospitalizations for injury, but I must say we didn't formulate the questions well enough, and I think partly because we didn't have enough time to pre-test them and to validate them adequately. So the data from that were really inconclusive. And one of the other issues with the hospitalizations now are that most people who are injured will go to private hospitals rather than the public sector hospitals. And most of the private hospitals are not part of whatever remaining bit of the information system is working. So there are a lot of interesting questions about that, and I don't think we have those. Now, about worrying about the conflicts in other countries. I think that there is some. I mean, one of the instances that comes to mind this week that we've had in discussions about Srebrenica has been the enormous amount of angst that continues in the Netherlands over the failure of the Dutch troops to adequately support and protect the Muslims in this supposed UN safe area. But I think that to some extent, you have to be a distance away from this before you can really start thinking about this really thoroughly. And I certainly know in UK there is still considerable amount of a feeling of guilt over certain events in the colonial era that has permeated society. This past year I had the opportunity to spend some time at Hiroshima and to see the concern by many groups in the U.S. about the events related to the bombing of Hiroshima. So I think that's a bit out of my purview. So if you don't like that answer, then ask somebody who knows more about it.
Thank you. Peter.
Reading some of these books about the war, about the collapse of public hospitals, I'm wondering the death rate from nonviolent deaths has gone up. That might be related to that.
Yeah. The one that comes to mind right now is in one of the university hospitals in Baghdad, there were, and of course, as some of you might know, medical specialists went either to the US or to UK to get their training. And there were, before the invasion, there were about, in this particular hospital, somewhere in the area of 120 surgeons with full qualifications either in the US or in UK. The report that I had about a month ago was they're down to 2 now. And if you're a medical student graduating from university, well, if you're a medical student now, you're doing many things that consultant physicians were doing 3 or 4 years ago. And if you're a medical student graduating from Baghdad these days, there is no chance you'll get a transcript because there's no way to get out of the country and practice medicine someplace else. The intent is to try to keep as many people there to fill in the gaps. So we know a little bit about the kind of human resources side of things, but issues like electricity, issues like just the safety in getting to work and back and so forth are clearly demoralizing. The BBC, I think the Fourth Channel had a series on hospitals in Baghdad last year, and it was I thought, a very revealing series of accounts.
Please.
Did that show up in the death rates? That's what I was asking.
No, statistically, we did not see an increase. We saw an increase, but it wasn't statistically significant in nonviolent deaths.
I understand you have to exclude that Fallujah data from the whole country survey, but could you go back and look at that data independently and say what happened in Fallujah?
What we did, as I said a bit in the beginning, we oversampled this time when by chance we got Fallujah again in the selection process, and it warranted one cluster. We did 3 there, and I think in all 3 of them the mortality rate was about the highest of any of the clusters that we had in Iraq. However, there we have this huge problem with the denominator, because there's not even an agreement on what the population of Fallujah was. Before the invasion, the commonly accepted number was 500,000. Then shortly after the invasion, it was reduced. And then when the U.S. was making a point of how Fallujah had been pacified and such a large percentage of the population had now returned, the population had dropped to 200,000. So it makes the percent look better, but it makes the absolute number probably not very good. So I don't think that we have enough numbers to say specifically, categorically what happened. But clearly airstrikes were a huge issue in Fallujah, and other causes of death were common as well. But other than that, and as I said, when we put the 2006 data together, just by chance we got the one cluster that had the lowest mortality, but still it was an outlier.
How many of those civilian deaths were from Iraqis who were in the army or in the police force?
Well, that's a very good question, and I wish I could answer that. But in this type of survey, that's not a question that you can easily ask to households. Were you a member of the militia? Were you a member of the police? In some cases, in fact, in a fair number of cases, spontaneously the households responded that these were police recruits that were standing in line to be recruited, and there was a bomb explosion, and they were killed. So we know that's an issue.
The reason I ask the question is because the media is so concerned with the number of American soldiers that are killed. That's the number that you see all the time. And although there are so many Iraqi civilians killed, some of them are in the same.
Well, I'm sure that some of them captured in this were combatants, but who they were and so forth, that's something that we can't really tell with this type of survey.
So when you say civilians.
Yeah, when you say Iraqis, I think so.
Iraqis, that includes police and soldiers.
I'm taking you as I see your hands go up, so in the very back with the hat on.
Thank you, first of all, for your important, if sad, work. I sometimes feel we should be counting less and mourning more, or doing something about it more, and I believe that you are, and I thank you for that. When the first study came out, it was attacked, and I have two questions about the way this report has been attacked, and the way your work has been attacked. The first is, how do you see the balance in the coverage of the report on the one hand, the substance of the report, the arguments about the methodology, as opposed to the attacks on it? Do you feel that the report has been given a fair hearing in the way that it's been covered, first of all? And second of all, in terms of the attacks, the first I heard was Bill Kristol dismissing it at a forum I happened to be at. It was not on that topic, but in passing, he alluded to it in a very dismissive way, as if it was just a known fact that it was something that could be dismissed. So I'd like you to address some of the specific attacks and whether the extent to which there was any credibility. You mentioned a few criticisms, but in terms of the overwhelming the attacks as they were presented to the public, if you could address those in particular.
Well, I'd say overall, the second study had, I think, a lot more traction than the first study did. And I think that the second study, we learned a lot from the first study, and I think methodologically, the second study was much sounder than the first study. So from just a survey methodology, we learned a lot, and we applied that, and I think if we were to do another one, there are things that we would do differently as well. However, the second study had a lot more credibility, I think, overall. People were prepared for what they'd seen on television. People were prepared from the first survey. People who took time to think about the second survey and look at its comparison to the results of the first survey, saw the similarities, saw the issues with death certificates and so forth. So I think overall it's had a lot more credibility. I think another issue is that we have tried with the second one to dispel the ideas that there were major political motives behind it, and I think that has been a bit more successful. It's not been quite so easy to dismiss as a political gesture in some way. And we've also tried to put more emphasis on the fact that we're talking about big numbers. We're not wedded to specific numbers, but whether we